What's up, y'all? This is Dr. Bartou with Pill Talk. I got my special guest here, Dr. Jessica Johnson. She's a VA pharmacist, also founder of Dream Secured Mentoring that we will discuss. Dr. Johnson, you can introduce yourself, let them know a little bit about you.
Hi guys. Yes, I am Dr. Johnson. You call me Jessica. I'm from Anderson, South Carolina, but I currently reside in Illinois. I am a clinical pharmacy specialist for Captain James A. Lovell Federal Healthcare Center. It's a very long name.
Yes.
And I work in an ambulatory care setting within that facility.
All right, dope. So let's talk about how did you get into that field? So after pharmacy school, what were the steps to become a critical care pharmacist?
So after pharmacy school, I did 2 years of residency. So kind of backtracking into pharmacy school. So I went to South University School of Pharmacy, now mainly solely located in Savannah, Georgia. So there was a campus in Columbia at the time. And that program was an accelerated program, or is an accelerated program. So it was a 3-year program. And so we went to school year round.
Yes.
It was great. But in that, you know, usually when I went into pharmacy school, I was like, I'm going to be a retail pharmacist. Because that's the only path that I knew at the time. So that was what I was going for. And then I made someone be my mentor, Dr. Marquita Winder. And she gave me the viewpoint of becoming a clinical pharmacist. So she was one of our professors, but she had an endocrine clinic at the VA, the local VA in Columbia. And so she put me on the path of what it takes to get into residency. So that's volunteering, having leadership roles in pharmacy school, good grades. I kind of cheated on that end. And then having really good clinical experiences as a student. And so she really helped me to kind of guide that. Doing research was a good big thing at the time too. And so Dr. Kendrick Ware, he helped me with a research project. And so from there, you do the application process. And so you do a 1st-year residency, which is just general practice pharmacy. So you get your hands into all of the clinical settings that are offered at the facility.
Yeah.
So, you know, like I wanted to do VA facilities because that's where my mentor was, and I also liked the independence that you can have as a pharmacist in the VA setting, or the autonomy. So 1st-year residency was in Dublin, Georgia. And at Dublin VA, the real name is escaping me, but there it was a VA, and I did inpatient staffing, outpatient staffing, geriatrics, acute care, anti-coag, pretty much a gambit of training. And that was one of the toughest years I've ever had.
I bet.
Yeah. So, you know, you kind of try to figure out, you realize you're not as smart as you thought you were.
Mm-hmm.
And residency really shows you your areas of weakness or areas for improvement. And people really hone in on that. So it can definitely be a blow to your self-esteem. But it's all in the process of molding you and to be a better clinician. So 1st-year pharmacy residency there. And then I thought I was going to go into palliative care and pain management. No, did not happen. So that would be my 2nd year of residency. And in that year, you specialize. And so I interviewed for pain palliative residency programs, and I also interviewed for ambulatory care programs. Try to, you know, keep it spicy. But
Okay.
I ended up, I ended up doing ambulatory care here at Captain James A. Lovell. And so the 2nd year, you're solely practicing in that particular area that you are going to specialize in. And so a lot of ambulatory care, which is chronic disease state management with veterans. Actually ended up doing pain management, and my facility is a federal facility. And so we see active duty military, we see retirees from the military, as well as veterans, because there's a difference, and different insurance. And then we also see dependents. So we see pediatrics, we see women. It's pretty much anyone from newborns to 105. Then that was my oldest patient, 105. And so, yeah, did my training there. And then they hired me on after that. I feel like I'm rambling. So do you have specific questions?
Nah, you're good. So what it really sounds like, the first year is general. You get to touch all the bases within the hospital as a pharmacist, with inpatient, outpatient, general hospital, doing the IVs and all that. And then second year, you become very more tuned in and just focus on that one. You had mentioned one thing, like the residency is very humbling. So like we all leave pharmacy school thinking like, oh man, I know what all these medicines are, I know what they do.
Yes. Yeah.
It's a difference from knowing what it is and actually practicing it, yo.
Yeah.
And I can tell like the first year was one thing, that's that transition of knowledge base to application based.
Right.
Yeah.
And that's one of the reasons too why I wanted to do residency, because we learn all this information in a short time frame, right? And then you're expected to be a doctor of pharmacy once you graduate. And I was like, I'm gonna need a little bit of a safety net coming out here in these streets. So that was one of the reasons I did residency, because it really allows you to learn how to apply the knowledge that you gain in real life settings. And so residency gives you about 2 to 3 years of training in 1 year. And so that really helped me to make sense of the things that we learned in pharmacy school. Even like just when I graduated pharmacy school in June of 2015, and I started residency like the first week of July 2015. And so I didn't have like a month to study for my board exams or law exams. So I started residency and was studying for boards at the same time. And really a lot of the things that I was applying for my first set of rotations, or learning in my first set of rotations, was on my board exam. And so thankfully for that, it really helped me to, I'm pretty sure, pass my board exams. Law is a different story, but I passed it, but by the grace of God.
That is good, because you was already practicing it and applying it, because when we take those exams, the national exam to become a pharmacist, the question isn't what is this medicine and how is it used?
Yes.
The question is more of, this person has this disease state, they take these medications. Now, can this medicine be incorporated in this and not interfere with the other ones? And you got to understand, like, okay, what are these medicines used for? Because they're not going to tell you the information. Like, so you got to have the knowledge base of what everything else is used for. Does this drug have an interaction with any of these other drugs? And the actual person's state.
How they present. Yep. Yeah. So that definitely, that's one thing I like to tell mentees or students in general, especially in pharmacy school or in the medical field. Like, yes, it's great that you can pass an exam, but can you apply this to a real person? So, taking into account the patients that you have on your exams, look at it as if it's a family member. And how would you treat that family member? I treat all of my patients like their family. Some of them probably are family at this point, but yeah, it definitely helped with that aspect for sure.
I talk to my technicians and my staff, and I tell them, like, yo, everyone that comes through the door, we got to treat them like they're our favorite cousin. We happy to see them, and we're also happy for them to go. You know what I'm saying? Let's let them come in, let's handle the business, let's laugh, let's joke, and be like, I'm gonna see you next time. So it's a warm welcoming, a hard goodbye, but we'll see you next time. We'll be right here.
That's a good outlook. That's a good, yeah.